So let's talk about changes in healthcare. Healthcare is very, very expensive in the United States. We're 4.2% of the world's population, and we are 51% of the world's healthcare bill. So how expensive is our bill? Well, it's in the trillions. It's 4.8 trillion, almost $5 trillion. Now, when we say those words, and you hear it on the news a lot these days, millions, billions, trillions. If I ask people to draw out $1 million in numbers, most people would know, okay, I gotta have 6 zeros. Most people know that. If I asked you to do $1 billion, then a lot of people wouldn't know how to do it. And if I asked you to do $1 trillion, very few people would know how to do that. So let me give you some context between $1 million, $1 billion, and $1 trillion. Remember, our healthcare bill is in the trillions. So if you were to start counting seconds or watching the clock tick, watching the seconds go away, to watch 1 million seconds tick by would take 11 days. If you were to wait for 1 billion seconds, it would take 31.5 years. If you were to do 1 trillion seconds, it would take 31,709 years to watch those seconds tick by. So you get the difference. It's not like jumping from 100 to 1,000. From 1 million to 1 billion is a big difference. From 1 billion to 1 trillion is an even bigger difference. So when you hear these numbers floating around, keeping it in context of how big those numbers are. Our healthcare bill is $5 trillion a year in the United States. That is way outpacing any other country on the planet as far as healthcare expenditures go. And when you look at how well does it work for us, we're ranked one of the unhealthiest countries in the civilized world. Our life expectancy has dropped for the last 5 or 6 years in a row. Our infant mortality is not even as good as it is in some third world countries. That means how well does a baby survive the first year of life? There are third world countries where babies have a better chance of surviving the first year of life than in the United States, where we spend trillions of dollars. Remember, 31,709. That's a lot. There has been changes in Health and Human Services. We have a new administration. They picked a new cabinet, and they appointed a new head of Health and Human Services. That head of Health and Human Services has a different viewpoint than what we've seen in that position for probably my entire life, and I'm 63 years old. So there's going to be changes occurring because of that viewpoint. When there's a group in charge of anything, they're not going to want to give up that power. The more powerful that group is in terms of finances and dollars, the harder they're going to fight. And there's a lot of things they can do to try to discredit the people that are trying to change things. I don't think anybody wants to make America unhealthy, but I think what we've got to do is to make some changes to make us healthier, because if you watch some of my videos, you realize we're a very unhealthy country. We spend a lot of money to be an unhealthy country, more money than any other country in the world, and we're getting unhealthy results. So to suggest changes, I suggest we should all be open to the idea of maybe there's better ways. If we're spending more money and getting worse results, maybe we should be looking at different ways to do things. I think that's all that's happening now. Be prepared that the people that are in power are going to be very, very, very resistant to any changes, because if they're making money off of it, which we suspect a lot of them are, they're not going to want to see any changes. But we have to look at ourselves as a nation. Are we the healthiest we can be, and are we living the right model of healthcare? I would say we're probably a little bit off the mark. And it's time to introduce some new ideas to help us get us closer to being a healthier country at a much lower expense.